Good morning. I'm Dr. Pablo. I'm here to examine you today. What are your complaints for the?
My main complaint is that I have pain in the left leg and pain in walking, and there's also resting pain, and there's like lack of movement in my left leg.
Can you tell me how long are you feeling those symptoms?
First, I started feeling pain 1 week ago, but around 1 to 2 days ago, the pains are very intensified. That's why I came to the doctor today.
Are you walking properly? Do you have difficulties in walking?
Yes, I have difficulties in walking.
And in a scale from 1 to 10, how much is this pain?
The pain is 7 or 8 out of 10.
Okay. Fadi, we need to examine you. Can you tell me more about your habits, your personal habits? Do you smoke? Do you have any chronic diseases?
I have diabetes, I have hypertension, chronic hypertension, and I have what you would call as a bad diet, sedentary lifestyle.
Do you take any medicines?
Yes, for hypertension I take vasodilators.
For how many years?
For 1 or 2 years.
Okay, Fadi, right now I need to examine you,
Yes.
check your leg, and you're gonna do the diagnosis of it, right?
One.
So Fadi, can you tell me please what meds do you take for diabetes?
I take for diabetes.
So is it a chronic diabetes?
Yes,
For how long?
I have it for like nearly 10 years now, but I don't really follow the diet that the doctor suggests me. I still have that diet.
But can you tell me more about your hypertension? You take how many meds for hypertension?
I just take one
And for how long?
one medication, and when I don't take vasodilators, my heart rate, my blood pressure is really high. But when I take it, it's around 90 to 100.
Which I didn't ask.
I think you can think about the test you want to make me do.
Yes, the test.
Lab test.
Fadi, when you were admitted in the hospital, did the doctors did any blood tests on you?
Not yet.
The nurses?
Not yet.
Okay, so do you know what's your average glucose level? Did you check this morning?
No.
What about your pressure? Did you check it?
No.
But do you have any idea how much is it?
I took medication for vasodilators today, so I think it will be around 90 to 100.
90 to 100.
Oh.
Fadi, we're going to check your cardiovascular system right now, okay? Okay. So we're going to start with the palpation. I need to check your heart configuration, is it okay? So, Fadi, I could perceive that your heart is a little bit increased, the diameter in the region of the left ventricle. I'm going to pass the auscultation of your heart. Is that okay?
Yeah.
So, I'm going to auscultate first your aorta, your pulmonary trunk, your mitral valve, and your apex. But they're going to check again your mitral valve, okay? Okay, but during this auscultation, we perceive that you had some movements in the mitral valve. We need to check on ECG and electrocardiogram to see if you have any disease, right? And that is also. So we're going to check the peripheral cardiovascular system of the patient. So first of all, for this inspection, we're going to pass all the way through vascular regions of the patient. Then we're going to observe the left leg cyanotic. You can observe the color here. So we're going to pass the palpation of the patient. We can check the temperature in our extremities in the body. We're going to observe that the temperature of the left limb is decreased, it's going to be colder. We're going to also, we can check the feeling of the patient. Fatigue, can you tell me when you start to feel anything?
Yes. No.
Can you feel in the left leg?
No.
Anything? The right leg?
Yes.
Okay. Fatigue, I'm going to check your pulse, okay? Both fingers. So, first one is going to be the radial, then the brachial artery, then the subclavian arteries, then the carotid, abdominal artery. Going to check the femoral artery too, popliteal arteries. In the popliteal artery, you cannot feel the left popliteal goodly. So also the posterior tibialis is going to be absent in the left limb, and also dorsalis pes is going to be also absent in the left limb. And you're going to state, you're going to do for the patient the monitor to check the pressure, both limbs. We can state that it was 140, 140, and 140 and 90 in the left limb. So checking the ankle and brachial indexes, we're going to state that we're going to divide the values here. You're going to be 1 to the right part and 0.64 in the left part. You can conclude that observing it, the patient has some degree of obstruction because dividing it, it was 0.64, and below 0.9 indicates an obstruction. So for the after examining you, I could perceive that your general condition is not so satisfactory. You look older that you are prepared to do the hypertension. Also, you are red, your skin is red. You present a forced posture due to pain. As I could perceive that you also have like a clubbing nails. It's an indicative of the disease, and that's you also suffering a lot with the pain, and that's why you're gonna admit you in the hospital, check some treat. Yeah, and you are. I could perceive that you are also obese. You compare your height and you're on the 30 and BMI. So you're gonna admit you in the hospital to treat. And I could conclude that observing these signs that you are that you have atherosclerosis in the leg. So for the after inspection of your respiratory system, observing it, I could perceive that during palpation auscultation and verification that you are dyspneic, you have dyspnea. Also, your elastic movements of the chest is compromised. Your form of the chest, you can perceive that it's a barrel shape well. And during the auscultation, I could perceive that you have some cracking, rubbings, because your lungs are being compromised due to smoking. So you probably have concomitant disease. But we need to check as well other systems. For the after inspector of charity system, your neurological system in your urinary system, I could perceive any abnormalities. Everything is going under the normality. So I'm gonna proceed to the checking of your cardiovascular system. All right. So I asked for some laboratory tests on the patient. We're gonna ask for the total blood count of the patient, as well as glucose levels, cholesterol levels of the patient, and platelet count and the bleeding count time. So observing the results are going to be increased glucose, increased platelet time, and increased so then the result is going to be increased glucose, increased platelet time and increased cholesterol levels of the patient. So they're gonna pass to the instrumental test. The instrumental test is gonna be a chest X-ray and a chest ultrasound, and in the peripheral areas, it's gonna be a Doppler angiography and also a ultrasound of blood vessels.
1.
So during the pain treatment, during the patient treatment, we're gonna give to him thrombolytics, to blood thinners. We're gonna give as well as antihypertensive drugs, vasodilators. We're gonna give medicines for the glucose level, as well as we're gonna recommend the patient to alter his diet. So we're gonna observe the signs of the leg that we previously observed. So if the medical treatment is gonna do any effect, we're gonna observe restoration of the temperature and sensation. The pain is gonna be, there is not gonna be pain anymore, and the patient is gonna as well restore his movements on his legs, and the color will be restored. But in this situation, the patient do not present any improvement of his clinical picture, so we're gonna recommend to him surgery, that's called thrombectomy. We're gonna insert a catheter in his femoral artery, and we're gonna inflate a balloon after the thrombi, and gonna take the thrombi off. After it, we're gonna observe the signs on the leg, and the leg will improve as prior mentions.
ABI, ankle brachial.
And the ankle brachial index is going to be as well restored. We're going to observe 140, 140, 140, and